Yeah, hello. A very warm welcome again back to KDRTV Live. It's 12:43 Central Standard Time. It's 1:43 Eastern Time, and it's good to have you on again, as I promised almost 45 minutes ago. We're back on to talk about COVID-19. As we said earlier on, we've been talking about driving a positive narrative. Earlier on, I had a very interesting discussion about sports and its role in socio-economic growth. And then later had that good conversation with John Letno, the current mayor of Ramsey, who is also running for the position of Anoka County Commissioner. But now we're moving on to talk about COVID-19. Really, it's a discussion that has been around not just in kitchen tables, homes, or offices, but it's really that affected people all around in the world. So we are honored today to have on the show two distinguished medical doctors who will be talking to us about what really needs to be done in preventing, managing, and treating COVID-19, especially during these very uncertain times. So as we promised earlier, we'll be having on the show momentarily here Dr. Edwin Bogongo. Dr. Bogongo has been a visitor to the show quite a number of times before, very distinguished in his career. He's also an internal medicine physician and also director of the Liner Health, and also is also the chief a medical officer with Diaspora Care, who also happened to be our sponsors, and is the good-looking guy who is now on our screen. We also bring here in a moment Dr. Andrew Kirago. Dr. Kirago, I think for those who know him, one of the most accomplished medical doctors. He's also an associate professor at the University of Minnesota. So very honored to have the two medical doctors to talk to us about really what it means to really prevent, treat, and manage COVID-19. So let's begin with you, gentlemen. How are you doing?
Hey, Dr. You're doing good. Good to see you.
So good to see you too. So let me begin by acknowledging one aspect of it. I think if you look at the chin, both of the three of us seem to be great. I think that's a sense of wisdom. It's interesting. A few years ago, Dr. Kiragu was this young guy. Now he's great. Edwin, it's good to see you. But how are you doing so far?
Well, I'm doing good. Doing good. Thank you for having me.
Andrew, how are you doing?
Doing fine. I mean, we are living under a new dispensation, but we do our best. We pray to God, and He does the rest.
Very good. So for the interest of our viewers, I mean, a quick intro there, but I think it's good for you too to get to be known by our audience, which is really here in the state of Minnesota, across the country, and some actually watching from Kenya. Let's begin with you, Edwin. You've been here before the show. Do you mind introducing yourself one more time again?
Yeah, my name is Edwin Bagonko. I am from Kenya, obviously, born in Kisii, grew up my adult life in Nairobi as a student at the University of Nairobi and practiced there for a while. I think I've been here 20 years now. It feels like yesterday, but I practice internal medicine. Also involved in a few ventures to try and help solve some of our health issues on the continent through a platform called Diaspora Care, which I'm happy to talk about in due course. I think that as a physician in our community here, obviously very interested in making sure that our people are well informed. We disproportionately support the healthcare system in terms of how many of us work in healthcare. And I think it is fair that we get a chance to talk about it and make sure that our people are staying safe and they're informed. So very happy to be on the show.
Okay, good. Also, very happy to welcome Dr. Andrew Kirago. Dr. Kirago, some of us have known you for many, many, many years. But for the benefit of some of our viewers, do you mind reintroducing yourself, please?
Obviously from Kenya, born and raised in Nairobi, a proud graduate of the Alliance High School, strong to serve, and moved to the US now almost 30 years ago, and studied medicine and have been practicing in Minnesota now almost 22 years. My specialty is pediatric care, which means the intensive care of children who are in the ICU, and also do a number of different projects here, advocacy for children here in the state of Minnesota, across the country, but also involved and engaged in some projects with training the next generation of pediatric critical care doctors back in Kenya.
Good to have you both, gentlemen. I think it's an absolute honor to moderate this discussion with two very distinguished medical doctors. But I do also want to acknowledge to our viewers that I am not a medical doctor. I'm a business professor, and therefore not very smart in this. I will moderate at the same time. I will be a student today, so I won't be using that medical jargon, if you'll excuse me for today. Okay. So let's talk about COVID-19. Obviously, I want to ask about yourselves, but you, the two of you, really at the forefront of this COVID-19, and quite a huge number of our community, especially the immigrant community. I think almost 60-70% of our population work in the healthcare industry. So clearly, you are the forefront, and that's quite really of interest for us. And those of us who are not there, in one way or the other, we have relatives who are also working in that industry, and many people also probably do not understand what this is. Do you mind sharing with our viewers how you're dealing with it from a personal standpoint and as well as from a professional standpoint? Beginning with you, Dr. Bogongo.
That for those of us who are treating patients that have COVID, it's obviously, I think initially it's very scary. I think we have had a lot of stories about initial healthcare workers that got infected. We've lost a few colleagues. I think we have done a much better job of getting prepared and understanding how to protect ourselves from a standpoint of wearing the right protective equipment and following protocols as directed by the CDC. I think we've also done a good job around educating our fellow healthcare workers so that it's one of those things where if we all do it together, I think everybody gets the protection they need. I think the challenge is really just watching the mayhem around you, and sometimes you have really sick patients that you lose, but I'm happy to say that we're much better at treating COVID. We are losing very few people now because we have better protocols. I think we also have a very informed population. People are coming to the hospital a lot sooner than they normally would. So at this point, I think I feel very confident that both from a professional standpoint, in terms of our fellow physicians and other healthcare workers, I think we're doing all the right things. And I think there's a significant effort in the public health area to make sure that we are doing all the right things, social distancing, wearing masks in public places, and now expanding the idea of testing. I think, when you have symptoms that you think may be COVID related, we're having a lot more outlets for testing. And I think that's overall helpful.
Okay, very good. Thanks, Edwin. And to you, Dr. Okari, how are you dealing with it personally and professionally?
So, as Dr. Bogonko said, it has been a disease that initially and continues to create a lot of concern for people who work in healthcare. If you look at the numbers of positive tests in our own state of Minnesota, there are about 96,000 positive cases, and of those, about folks in healthcare who have tested positive. So this of course then begins to be significant concern, and as you alluded to, a lot of people from Kenya work in healthcare at different levels, from physicians, nurses, advanced practice providers, and nursing assistants in nursing homes. As you know, some of the folks who are hit hardest our elderly our senior citizens in what they call congregate communities, so people who live in nursing homes and who are cared in many cases by our fellow Kenyans. So as a pediatric physician, one of the things we have noticed is that while children have been affected with this illness, the number of children who have become critically ill is limited. So in that way, we have been, in some sense, protected from what our adult medical providers are seeing. However, we have to maintain a high level of alert because many people, both adults and children who have COVID-19, have no symptoms. And so you might be admitting a child for one problem, and if you don't test them, you can be exposed to COVID. And as we know, a significant number of people who have the disease are asymptomatic, but can still spread the illness. So you have to be very careful.
So, good point. Thank you for giving your perspectives on how you're handling it personally and professionally. But let's focus for a few minutes here on the healthcare. Obviously, this is a virus that doesn't, it doesn't know boundaries demographically, whether you're young, old, whatever that is, it doesn't matter really. But let's focus on those who are working in the healthcare industry, nurses and nursing assistants that you talked about, Dr. Kiragu, and I'm going to begin with you, Edward. What should they do really so that they prevent this from spreading? Talk to the nurses or nursing assistants or anybody anyway who works within that industry. Dr. Bogongo.
I think we know that COVID-19 is deadly. And so there are really no shortcuts. If there are guidelines in every institution, we have guidelines for what to wear when you get into a patient's room. So following those guidelines is paramount. Because you're not only protecting yourself, you're also protecting your family. Because it's very easy. I think earlier on we had a few of our countrymen infected with COVID and taking it home. And so number one is just to follow the CDC guidelines. All healthcare facilities have those guidelines. And the other piece is if you wear scrubs or you wear clothing that you use at the hospital, either find a way to get off those clothes while you're in the hospital, put them in a bag, and isolate those clothes so that you're washing them. I know some people, when they're on service in the hospital, they quarantine themselves from their family, maybe go through a different entrance to the house and make sure you leave your hospital connections elsewhere, take a shower and so on. And also, get a chance to wear a mask in public and so on. So I think when you're in the hospital setting, absolutely wear your protective equipment. When you come home, try and avoid any contact with the clothing or other tools you use for your job, and protect your family from any exposure. I think the other piece is that if you work in a congregate setting like a nursing home or a home for the elderly or a group home, then be conscious that if you're moving from one job to the next, that you actually follow the same guidelines. So if you're working in a nursing home and you have a second job in another setting that is similar, also think about the people you're going to take care of and protect them. Because if you were the source of an infection from one place to another, remember, if it spreads to more residents in the place you work, you're really, really increasing your own risk of getting it. So those would be the suggestions that I give. And then lastly, if you develop symptoms, if you have a cough or a fever and so on, you lose your taste or smell for food that you normally eat. There are telltale signs that we try and share with everyone every day at work. If you develop those symptoms, you have to let somebody know. Go to your employee health. If you feel unwell, there are guidelines now. I think most organizations will protect your your income while they evaluate whether you have COVID. So those would be the simple things we can do to protect each other and to protect ourselves.
Oh, very good. Thank you, Edwin. Dr. Kirago, I think you want to add on to the same. What should really the healthcare workers do? But also on the same note, knowing that you're also a professor, and obviously your focus is more on children. It's natural, I think, when the same workers that Dr. Bogongo was talking about, once they get home, the first thing they want to do is hold or give hugs to their children, and children are obviously very innocent. Or the moms, for example, they want to really touch their children because it's an emotional aspect of it. But also the kids have to run to daddy to hug them. But that could also be problematic. Do you want to speak to the same? What should healthcare workers do at the same time when they get home? How should they protect the children?
I agree completely with Dr. Bogonko. I think it is very important when you are coming from work as a healthcare worker to make sure that your family members do not get into contact with the clothing that you are wearing that may then expose them to COVID. For many healthcare workers, depending on the setting they work in, they are screened as they are coming into work, whether it's through their temperature being checked, or whether it is through this honor system where you're asked whether or not you have any of the symptoms. And folks sometimes are worried, I may have this one symptom. Should I say it? Because if I say it, maybe I won't be able to work for the next 14 days or whatever. But I think the honor system is there in order to protect you and protect your co-workers. But definitely, the science is there. The way you protect yourself and your loved ones and your patients, it's there. And it's not rocket science. It's very simple. Attention to proper hygiene, hand hygiene, washing your hands, wearing a mask, keeping social distance, making sure the surfaces that you're using multiple times are clean. And if you should happen to be positive for COVID, there it becomes a bit trickier, right? Because you then have to figure out a way you're going to make sure you isolate to the maximum extent, whether or not it's staying in a separate room, locking yourself in the basement, making sure that if you're using any facilities on the bathroom or whatever, that you wipe everything down. So there are many ways that your life has to adjust so that you don't end up infecting your own family. And many people live with their elderly parents, so who are even at higher risk from catching this illness. So you want to be really careful in following whatever the rules that are there to keep yourself and your loved ones safe.
So good point. Thank you, Dr. Kirago. Dr. Bogongo, on the same note, actually I have a family friend who is very guilty of what she thinks she might have done. A nurse went to work and came back home, wanted to serve her father food in the evening, and out of that, the father got the COVID and unfortunately passed on. And she can't leave this guilt. She's so guilty that it's because of her that probably the father went a bit too soon. So what do you say to families or children, for example? What should they do? How do you teach them to understand that there is COVID, at the same time also protecting the elderly, our parents, who probably still believe this thing doesn't exist?
We are not reinventing any new information. I think if you think about COVID and its symptoms, if you remember when it first happened in New York, the death rate was just incredibly high. So we know it's a deadly disease. I think two things: we have to believe the science, believe the guidelines were being given by the CDC, because that's what everybody's following. So if you choose not to follow that because you don't believe, I think you're really putting yourself at risk. I think the issue about guilt is real. And it's not just guilt for somebody who has gone home to find that maybe they infected their parent, which is extremely unfortunate. But there's also guilt of the caregivers, right? So you go and you treat one patient, you go from one room to another room, you find that the patient you just saw looked very healthy, and then the test comes back, they were positive, and then you realize maybe you didn't dress properly for the next patient. So early on, you can imagine how much people would drive home and start really getting stressed out. Did I take the disease from patient in room 1 to the next patient? There was a famous doctor, ER doctor who in the news in New York, who committed suicide because she thought that she had taken an oath to preserve life, and despite all these efforts she was taking, it became overwhelming because there was so much death around her. The reality is that the healthcare givers are really at risk of psychological turmoil because you are almost helpless in certain respects. At the same time, you are at risk of being the person who spreads the illness in a congregate setting or even in a hospital setting. And so why this is really important is that we need to encourage our healthcare givers, especially people in our community, to seek help. It's not There's nothing wrong with reaching out to somebody and saying, I'm really struggling with my involvement in patient 1 or 2, or the fact that I might have infected my children, because it's real, and it can, in fact, the studies that are coming out show that there's going to be a significant psychological scar left behind by COVID, whether you're a caregiver or you are an individual that actually gets infected and survive the disease. So my encouragement to our community members is to not only stay strong, but be ready to seek help, because the psychological effects of COVID are just as important.
Okay, good, thank you. It's interesting, and as we talk, I know there are a lot of people in our community, wherever they are from, whether across the country or around the world. If you have questions, please, for the two doctors, feel free to go to our Facebook page and post your questions there. We'll have a few minutes for them to answer some of these questions, noting that these are very senior doctors and they're in a good position at least to guide on what we need to do. So let's move on, and to you, Dr. Kiragu, you are professor, as I am. The good news for me is that both of the universities where I teach, we just chose to go remote or online for the rest of the year, and actually even the spring semester. So pretty much we might not be on campus until next summer or next fall, which is a good thing. But still, even that presents very interesting challenges. That means that those students already who are on campus, and they also some get back home, and they have to be home. So there is concern about this idea of students going back to school. What are your thoughts about this, or what is the medical department saying? Is that something that our community should be concerned of?
So thank you for that question. And it's a multi-level question. So there is the concern of return to school for young people at the university level, and there are many universities where they have chosen to either go completely virtual for the year, and others where they have adopted what they call a hybrid model, so a mix of going to school, doing in-person classes, or doing virtual. For younger children, this has become, in many ways, a more urgent concern. As you know, children learn best. They have direct contact with their teacher, direct contact with other children. There are many skills that children will be able to pick up and learn. There are many children for whom in school, especially elementary, grade school children, for whom school provides a safe space. It's a place where, for many children who grow up in poverty, that is where they are able to get meals, because maybe at home they have not been able to afford food. And especially for children who are poor, the whole idea of virtual is a little problematic. They may not have access to computers. They might not have access to the internet. So it becomes really, really problematic. The concern is how to do it safely. How do you safely send children back to school, knowing that even though when children get infected with COVID, especially the younger children, in most cases are mild, but they still are able to transmit the illness, and we don't want them to get COVID. But how do you let children go back safely, get the opportunities for learning, also prevent infection? And so there are different plans which have been discussed. There are different models. Many of us are probably seeing some of that with our different school districts. Some school districts choosing to go completely virtual, others choosing to do a kind of a hybrid model where your kids go to school for 1 or 2 days of the week, or 3 days, and then for the other 2 or 3 days, and so as to decrease the number of children who are together in a classroom, making sure kids are eating, allowing kids to eat in their classroom so they're not going, or if they're going to eat in a cafeteria, making sure they're spread apart, making sure that kids are not going from class to class, that if it's a different teacher for, if it's a mathematics or science or whatever, that the teachers are the ones moving, as opposed to the students moving from class to class, which means they'll be less likely to spread infection, leaving windows open. If there are opportunities for learning outside, doing that. So there are many different ways that this can be done in a safe way. But clearly, if you are the only breadwinner for your home, and you are the only one taking care of your child, and school in many ways provided ability for parents to then be able to go to work, and now you have your child at home. If it's a teenager, it's maybe not as big a problem, but if you have a young kid in first and second grade who you can't live at home alone, what do you do for care? And here again is where you see some of the difficulties in people who have access to money, and then those who do not, where you hear of some people even hiring tutors and bringing kids in their cul-de-sac or their for a teacher to come and teach their kids when they're at home. I mean, there are different things that people have done. Ideally, we would want children to go back to school, but this remains a problem. Hopefully, I'm not overloaded.
Yeah, no, that's good. It's making an economic argument. We'll make an economic that argument a bit later as well. But Dr. Bugongo, let's be honest, right? If you're talking to me, I might be a bit cautious because I'm thinking about my children, right? I want to be around here longer enough to see my grandchildren and stuff like that. That's key. But we are talking about teenagers who are in their 15, and they want to be on campus. They want to socialize. If you tell them there is COVID-19, they will tell you, no, that's for all these, it's not for us. And by the way, Dr. Kiragu was talking about the economic aspect matters. Most of our kids really fall under that category of probably economically disadvantaged. What do you say to especially the younger of our population really about COVID-19 and how they should prevent this?
Well, I think the younger people are going to be the most difficult, because that is a stage in life where they are restless. Their ability to follow instructions is challenging, as we know. And actually, school provides a very interesting environment for a parent. It's a little bit more organized, and it's very important that our children sort of develop these social skills. And that's being eroded. So you're going to find a sense that the young people, yes, it is true that they get a milder form of COVID unless they have other pre-existing conditions. And so it's always a challenge. I think that's the challenge of our time now, that it's probable that our young people are going to be the ones who end up spreading COVID more than anything. But I would just say that parents need to continue to have these discussions almost every day. I know I do with my kids, to make sure that they practice the guidelines that we all have. But reflecting on what Professor Kiragu said, it's really important for us to realize one fact. 19 is affecting disproportionately Black people, immigrants, people in a low socioeconomic status, And they're the ones who get the more severe illness. They die more than the average person. It's very hard. Imagine trying to tell people in Kibera to social distance. It's not possible. Imagine telling people in the projects to not to be sort of following these social distancing procedures when that's where they live, that's their environment. And so if you go by the experience of New York, that's a big deal in the sense that the social determinants of health, as we call them, are almost predicting how badly people will do with COVID. Now, let's come back to the household. If you have a parent or two who has to do 2 or 3 jobs to make ends meet, and they're depending on the school we all know that education is the equalizer. You're happy your kids go to school, somebody else is taking care of them while you work. Now there's this disruption in the family household, in the family economics, that is actually worse than it already is. The other piece is that if you are an immigrant who doesn't speak English, the school is really where these kids are going to learn a new language, learn the language of instruction and that sort of thing. So if you give a child a little laptop to come home with, and then it has malfunctioning, and the child is told, is there an adult in the room? Can you reset the computer? That person might not know where to find the reset button. The moral of this is that COVID is further marginalizing people of color, people of low socioeconomic status, people who are just starting to learn how to survive in the United States, and those for whom English is not their first language. So as bad as healthcare for them already is without COVID, I think what we are seeing is an acceleration of all these inequalities because of COVID-19.
We'll get to that in a moment, Dr. Kirago. We want to talk about really who is most at risk. And I know we talked about students or the younger population, but also know even on our college campuses, there is the older generation. Some professors are much older. The workers who work on campus, that could be an issue. But maybe that's a topic we want to talk about right after the commercial break, if that is ready. Okay. It looks like our guys should be going on commercial break. They should be working with that. Okay. So, as Dr. Kirago, maybe you might come in. Looks like Ben is busy also getting the commercial come on. Who actually is at most at risk?
One of the things that's I think been a myth is that children don't get COVID. So everyone can get COVID. In fact, it's only that for children younger than the age of 19, the illness is most times has mild symptoms or no symptoms at all. But if you look at the people who are most likely generation that's in their 50s and older, and then of course, as Dr. Bogonko alluded, the people who are most at risk are people who are Black and brown and immigrants. And because these are the folks who are generally at the front line. Think about, as we talked about, the people who are doing nursing, work in nursing homes or work as nurses or physicians. People who are the ones who are supposed to be working, helping to clean the hospital, people who are driving the buses, people who are driving the trucks. Think about the folks who work in the meat processing plants. As you know, food processing plants were deemed essential, and people, and a lot of people who work in meat processing plants, as we know, are immigrants, and so they are just the risk is much higher for those folks, and then of course anyone who has underlying heart problems, underlying congenital heart disease, high blood pressure, underlying lung disease like asthma, and also obesity. So folks who have those underlying conditions are at more risk from having more severe disease and unfortunately from succumbing to the illness. As Dr. Bagonko alluded to, we have gotten better at treating COVID and so you're less likely to die now from COVID, as people have recognized some of the things that can happen than you were when we first started learning about the illness. But it is still a significant, still a significant problem, and is the folks who get critically ill, they linger. This disease it lingers on. You hear people talking about the length of stay for someone who has been hospitalized with COVID, especially for those who have become critically ill, is quite long. And then you're getting through, and it's not only lung disease. People have talked about, you're on a breathing machine, you've needed to be supported. But young people who you'd never expect have had strokes because of COVID, young and old, have had strokes because it causes abnormalities in the way blood clots. In children, a disease process called multi-system inflammatory syndrome, which again, unfortunately, predominantly has been affecting Black and brown children. And if you think about it nationally, the last time I looked at the CDC website, of the almost 350, almost 400 children with this syndrome, about 38% were Hispanic and about 33% were Black. And in that Black population is included our own brothers and sisters. And so, and those kids can get pretty sick as well. So this is a disease that we're still learning about. And so I think being really cautious, being really thoughtful about it, as you can see, I mean, it's hard, right? When we were told first, you're going to stay at home in Minnesota, it's going to be, I think first it was a month and then 6 weeks, people are like, man, I can't stay in the house. I need to get out. I need to go do stuff. And we could see across the country how different states were responding, including people going to their state legislatures carrying guns to try and threaten their state legislators to let them go back to work or whatever, and not understanding that what they're threatening someone's life so that they can go risk their life and their lives loved ones. So there are all these issues that we just have to be really careful about.
So as we do this, we want to take a commercial break here shortly, and Dr. Bogongo, I want to bring in so that you can chip in. As we take the break, also note that we have families back in Africa, because right now we're live, and a lot of people watching from Kenya. I know people are watching from Uganda, people watching from Nigeria, South Africa, and I see some people also watching from Liberia. So we also have a loved one. Coronavirus is affecting people here and also back home. So we want to have your thoughts. People want to listen. What you say is very important. So when we come back, Dr. Bogongo, you're now chip on what Dr. Krau was saying, and also what our brothers and sisters back home should be doing. So I want to take a quick break here.
We know how stressful it can get to take care of the healthcare needs of your loved ones, especially when they live far away from you. Money transfer services have expensive fees. They cannot ensure that your money is spent on the intended healthcare needs. And there are many questionable pharmacies that sell low quality, unsafe, and even counterfeit medications. That is why we created Diaspora, a secure, quick, and cost-effective way to pay for the medications of your loved ones through our network of accredited and registered pharmacies. So here's how it works. Meet David. He lives far away from home. Unfortunately, his mother was recently diagnosed with diabetes, but she can't afford her new medication. So after funding his Diaspora account, David enrolls his mother as a beneficiary, and a unique PIN code is issued. Think of this as a digital voucher that David paid for in advance. David's mother presents the PIN code at one of our accredited and registered in-network pharmacies. The cost of her medication is deducted from David's account, and his mother can walk in and out of the pharmacy with the medication she needs. It's as easy as that. David can also assign his uncle who lives close to his mother as a caretaker to help her follow the new diabetes treatments. For extra security, David can also create one-time PIN codes and manually confirm and approve medication purchases too. It's easy to send more money home and hope they got spent on buying safe medication. But what if you can have control over how your money is spent, gain access to safe and quality medication, and purchase multiple medications for multiple family members who are in need? Your money goes a lot farther, and healthcare becomes a lot more inclusive. DiaspoCare was created by Diaspora members for Diaspora members that help provide greater access to safe, quality, and affordable medications for your loved ones back home. It's time for your loved ones to get the quality medication they need, and for you to get the peace of mind you deserve. Sign up today and register your loved ones for free at diaspocare.com. So,
and we're back live. Dr. Bagongo, you are the executive director of DiasporaCare, and I think following the previous question that Dr. Karago was so eloquently talking about, there are people watching right now from Africa, and I think some people haven't really taken this very seriously. In fact, I was having a discussion with my younger brother in Nairobi, and he was telling me, bro, don't come here, because you people come here, bring corona. Same is true if you're going to the villages. People think corona belongs to those in the cities. Or if there is anything in that neighborhood, they think it's the neighbor who doesn't have a good eye on you. What do you say to our brothers and sisters who are watching this from across Africa?
I think the first thing is corona is a new illness. We have to learn to trust the science behind it, right? We're all learning. There's a lot of research that's going on. There are certain things that are just factual, right? We know that if you have cancer, kidney disease, you have lung disease, you have any sort of serious heart condition, in the African context, people who have sickle cell disease, people who are suffering from HIV and AIDS, those that have diabetes, high blood pressure, they tend to be highest risk for getting COVID. And there's nothing about that you can translate into saying that your neighbor placed some bad spell on you and so on and so forth. So my advice to our people is this is a new condition. Nobody has, we're all learning, and there's a lot of science that is rapidly becoming apparent. We are treating the condition better. Please protect your loved ones. If it is your grandma or your mother in the village, you've got to create an environment that is almost a bubble. Who goes into the environment and protect them, because the effects are real. The other piece is that I think COVID has devastated the economies of developing countries, and Kenya is not an exception. And so you're seeing a lot of people having to struggle with affording medications because their children have lost their jobs, and so that is real. I think in this particular instance, I think the idea that there should be some effort to make sure that our elderly population with these chronic conditions that require expensive medications, there should be an effort, especially on the part of the government, to say, we're going to be supporting your treatment because we'll give you some support for getting these really life-saving medications. I think the reality is that since we're not doing sort of this widespread tests, there are a lot of people that might be dying from COVID that we sort of shrug our shoulders and say, oh, he was an older elderly guy and he had heart disease, and maybe that's what killed him. So I think to the extent that we are talking about personal responsibility, social distancing, wearing masks in public, creating bubbles around those at risk, I don't think that is unique to the United States. I would argue that it's universal. And so for those who are watching from our beautiful continent, please do the same thing. You have access to masks, wear them, protect your loved ones. If you have a family member that has any of these chronic conditions, just remember they're going to be at a higher risk. From a diaspora standpoint, I think there are two things I might want to mention. One is because there are sort of lots of companies that have followed individuals, so you're not working as much. I think there's going to be a strain. Now, Kenyans remit about $3 billion a year in support for their families at home, and even up to half of that money goes into investing in their healthcare. And so when they are not working here, you can imagine how that value chain is really crushed. And so I know families are hurting both here and on the continent, and that is why I feel that there has to be some concerted effort beyond our public health initiatives to look at how best to support those in our communities that are at risk, so that they don't get a double whammy. They get really worse with their medical condition, and God forbid if they get COVID, they have no recourse. I think that's the biggest risk that I see.
Okay, good. Thank you. On the same note, Dr. Craig, obviously we did talk about healthcare workers here in the U.S., but also this really should be a message in all seriousness. It should be a message to even policymakers, those ones in Africa and in Kenya, who should really take this serious. Some maybe are playing politics and may not understand the seriousness of what this says. What do you say on the same note with Dr. Bugongo? What do you say as well?
I think I agree with what Dr. Bogongo said. It is so important for both our policymakers, our healthcare providers, to take this illness seriously. I've been very encouraged by the efforts by physicians back home in Kenya to have sessions for education. What is a very sound plan in terms of taking care of patients who have COVID-19 care safely, but they do need support from the policymakers. And I think the initial stance of the government and many governments across the continent to really talk about the importance of wearing masks, washing hands, and where possible, social distancing, support provided by non-governmental organizations that went into places like Kibera to provide hand sanitizer, masks, and other supplies, groups that were going in to provide food, because as you know, while you're in a situation where you have access to surplus funds, you can afford to stay home and not work for some time. But for many people who are living from hand to mouth, that ability to do that is really non-existent. And so how do you support those communities? But it is so important that to prevent the illness, we definitely do not want a situation such as we are seeing in our own country here to happen in countries across our continent, where the resources to actually care for critically ill patients are fairly limited, and in some places much more so than others. So you'd rather the prevention is going to be much better than trying to figure out how you're going to get anybody who is suffering from critical illness from COVID. And of course, we don't want a situation where people are putting their head in the sand and saying that there is no COVID. This disease is there, and you can deny it all you want. Unfortunately, it is there, and it doesn't respect whether you drink whatever magic water people might be drinking from aloe or whatever different cures people might be doing. It doesn't respect or care about that. What it cares about is for people who are following the science, who are wearing masks, who are washing their hands, and as much as possible doing social distance. And it's unfortunate, to read stories about people in positions of power who have access to funds to help our people who are stealing money or jacking up prices of PPE or medications that might be helpful. This is unconscionable behavior, and to think that one day you might sit in your house and there's that saying, what does it profit a man to win the world but lose his soul, and to think that you are getting money that you stole that was supposed to help your countrymen and women be protected from getting this disease. This is truly, it's just so sad, and really no less sad than a situation where we have, as you guys know, you gentlemen know very well here, where COVID has been politicized. Never would any of us in the medical field ever have thought that you'd be in a situation where, depending on what political party you are, you believe whether or not that there is COVID. I mean, this is the most ridiculous thing I have ever had in my life. But this is where we are, which is why a country which has the most advanced healthcare system in the world, the superpower, really the only remaining superpower, have a 4% of the world's population, but 21% of the infections and 21% of the deaths. I mean, this is truly illustrates what a failure of leadership does. I mean, America went to war many years ago for 3,000 Americans being killed on 9/11. Currently, 202,478 Americans have lost their lives because of COVID. This is something that should be eating everyone. This is truly unacceptable. The virus doesn't care if you are Republican or Democrat. Doesn't care if you belong to Jubilee or Orange or whatever party. It doesn't care. It doesn't care if you are from Kisii, Kisumu, Moranga or Mombasa. It will get you if you don't do what you're supposed to be doing.
Dr. Bogongo, you want to add on to this? It's really sad, but again, the reality about life is sometimes, yes, you got to play politics, and I think what you're seeing in the U.S. is we are close to the elections, and what we are seeing really in the mainstream media is pretty much about politics. It's not about human life. And I think, as the statistics show, the people are affected most, quite frankly, are those ones who are in the low socio-economic status. And I think that's where a majority of our people belong. So I think it's important to underscore here that if you're an immigrant, you're in that low socioeconomic class, please take care of yourself. We need you, and those families back in Africa do need you. So let's not play politics here. Let politicians do that, but let's do our part, try to be as protective as possible. That's key. And I think back to the medical argument, I've watched very closely. Again, Dr. Grago, thank you for making that very clear. The medical argument from Dr. Anton Bauchi and those ones in the team, they've really been making a very good case about this virus. It is most likely going to continue for some time to come, and maybe the two of you are better placed to advise us and our viewers. Is there a possibility of another surge of this kind of infectious disease? Dr. Bogongo, beginning with you.
Yeah, so I think it's fair to say that we have seen a little bit of a flattening of the curve, if you like, for states that took this very seriously. I know most of them were blue states or democratic states. I think they were more able to develop very robust systems across many levels, whether it's business premises, public places, healthcare facilities. And what we are seeing are the fruits of that our curve was not as steep as, say, places like New York or places like Texas or Florida. I think it's very important that we continue that trajectory of saying that we cannot let go of our preventive strategies, right? So that should not be a political issue. In the words of one of the famous leaders who said that COVID should really be one of those situations where we say that the country is at war. And when you're at war, it doesn't matter which party you belong to, because lives are at stake. And as Dr. Kirago said, 204,000 Americans, that's too many people to die in less than a year. Having said that, at the end of the day, you have to look at yourself in the mirror. If you're a healthcare worker, there is an element of personal responsibility you have to take. You have to be a leader in your community, in your neighborhood, in your cul-de-sac, if that's the case, and make sure that you transmit the information that's accurate, promote social distancing, promote personal protection, and so on. because that's what it's going to take. We are moving into the fall and the winter season, which is traditionally where we get a lot of respiratory illness. Okay, so I'm going to say two things. One is that there is a sense that when the flu season comes along, the fear is that if we get a combination of flu and COVID-19, that it's going to devastate, again, our most vulnerable, who are the elderly, people with pre-existing conditions, people with chronic illness, which brings to forth the idea that our public health measures, our personal responsibilities, social distancing, wearing protective equipment, wearing masks in public are going to be extremely important. Also going to be important is the idea that we need to promote vaccination for flu. It might not be 100% effective, but I think it's going to become a very significant factor in sort of preventing a widespread outbreak of respiratory illness. The other thing is viruses are very smart. They evolve, they mutate, and if we get a variant of COVID in the setting of a flu season, then we are looking at some very unknown disaster around the corner. So I think what's really required right now is very, very good surveillance. All the hospitals and healthcare facilities need to keep reporting people that come in with any sort of respiratory illness so that the information feeds back to our policymakers. And if, where I work, for example, we've spent several months planning for the worst of the worst of the worst, so that you can only make these plans actualize and save people's lives, save healthcare workers, if the information is filtering in well enough that you can execute your plans and make changes. So I think there's a really big unknown what's going to happen, in the next 6 months, so October through March. I'm praying that we don't have a double combo of flu and COVID-19, because that would be a disaster.
Edwin, Dr. Kragu, I don't do the same. And guess, honestly, sometimes I do say prayers to God. I'm so happy that this really has not affected the African market as such. And I hope it doesn't, because if it does, if what we are seeing here could be in Africa, I don't think we'll have a continent. That would be really disastrous. So Dr. Vauci and others have been making this case of a potential surge. What is your take on that, Dr. Kragu, as we get to the end of this?
I agree, and I think, in fact, there are those who even believe that in many parts of the country we are still in the first, we are still dealing with the first surge, and you can see in places where policymakers decided to play politics, the rates of positive tests are going up. You think about our neighbors in the Dakotas. Where the number of people, the rates of people getting testing positive for COVID-19 are now way exceeding everywhere else across the country. But Dr. Bagonko is right. We can only pray that this coming flu season we are not hit with a double whammy of an additional surge in COVID cases. We are not hit then with all the other respiratory viruses that come around this time. Respiratory syncytial virus, or RSV, some of you might have heard. Of course, the flu right around the time. So dealing with a whole variety of diseases that when they do come, many times overwhelm the medical system, but now adding on to that COVID. And we've seen in countries where they initially had gotten a hang of and control of the viral spread, that they are beginning to see more and more cases, and so are having to begin to tighten back the public health measures that they had initially taken. Because the people get excited and they say, "Oh, there's no COVID, so this is what we're going to do. We're going to go back to living as if there's no COVID." But then, unfortunately, you're beginning to see, and there are some countries that have been successful. I mean, Vietnam is a country where they had, for the longest time, no reported deaths from COVID, and then very minimal numbers of COVID, but that's because of a very strong public health response. But then, through folks crossing the border illegally from their neighboring country, they were beginning to see a slight surge. A country like New Zealand, which had really more or less controlled their COVID-19 pandemic, are seeing some cases. And then there are some countries that had decided that they are not going to do anything. They're going to leave kama maisha aina chochote, like Sweden, that you can see have paid to some extent a heavy price for that decision, and are having to really rethink kind of an approach. So we can only hope and pray, but also be really firm and strong about following the science that is there.
I'm going to go, Ben, if you don't mind bringing the first question up. I think that's a fairly loaded question, and I think it's suited for Dr. Bogongo to respond to this. The interesting part is that sometimes what people don't realize that people do listen to their leaders. It doesn't matter your political persuasion, but the truth of the matter is people listen to their leaders. So if you're a Democrat, you're most likely going to listen to anything that Joe Biden and Kamala Harris say. If you're a Republican, it's likely you're going to listen to anything the president says, and that's it. And that's true to other countries around the world. If their leaders were going to say this, that doesn't exist, the likelihood is that people might believe in that. So to this point, Dr. Bogongo, there are those ones who think what the politicians say is the truth and nothing but the truth. What do you respond to that? And that's a fairly loaded question from Collins.
Well, I'm not sure that COVID-19 determines which party you belong to when it infects you. As Professor Garagu said, the data is showing that for those states that follow a lot more the Republican talking points of, there's nothing to worry about, they are paying a huge price now and playing catch up. I think the dichotomy or intersection between politics and our way of life and maybe business interests, to think that those have come in between the reality of how we take care of our citizens who have a very life-threatening illness, it should really cross all party and any line for that matter. So I do not believe that necessarily we should even be talking about whether we should be responsible citizens, responsible leaders. But you have to remember, that's the political discourse we live in. I think it's very clear in an election year, the leaders have to display this idea that they are in control. And if they are not, then they want you to believe that they were only taking their time to be in control and so on and so forth. I think for those of us in the healthcare field, we can't be lost into the political leanings of the day, except continue to do what the science tells us to do. There are a lot of people working day and night to make sure that we understand COVID better, from how to prevent it to how it reacts when it gets into patients, and what's the best way to mitigate against it getting worse, because COVID can cause all manner of things. It's not just lung infection. People are getting blood clots all over their body. You have 20, 30-something-year-olds getting strokes, getting heart attacks and stuff like that. So there's a whole slew of things that as healthcare people, we have to continue to be vigilant about, outside of this ridiculous declarations about COVID being this and that. If you remember, there's a famous church pastor who told his congregants that COVID is not real, and a few weeks later he got it, and it must have been a very sad funeral, because the church members were like, if the pastor said this and he got it and he couldn't get out of it, this must be real. But I look at this as needless deaths, if you like, because really nobody should die for something that we already have enough information to sort of keep protecting ourselves. The other piece of this is, I think I saw a question about vaccines. So we know, again, along party lines, there are those who believe that vaccines work and no, you should not have vaccines. So this is another of those situations where we need to trust the science. Now, developing vaccines is not, it's not something you go and type on a computer and generate a vaccine. It's actually a very elaborate process. Looking at the different, the life cycle of a virus, the response of the immune system, and figuring out which part of the immune system is likely to be evoked enough for you to develop a vaccine that can really maximally sort of stop the spread of disease like COVID-19. I think that I was very worried initially when they said we want to develop a vaccine in 6 months. The average life cycle of a vaccine is 21 to 24 months for those that have really gone through the elaborate process of being vetted. So 6 months was scary, and so the issue of safety came into play. Recently, I'm sure you saw that one of the big pharmaceutical companies had to halt a study in the United Kingdom because they had somebody who was going through their trials develop some really severe illness. The safety is a big deal. So I'm very confident that having seen there are about 6 to 8 major pharmaceutical companies that have been accepted as having the right direction towards getting a vaccine. And they finally formed a coalition, and they have all committed to the idea that no vaccine gets into the market unless it's safe. So the answer for that would be, if the scientists in our pharmaceutical world are coming together to say we won't release a single vaccine unless it's safe for the citizens of the world, then I would say that's very reassuring. I would also add that historically, we've gotten rid of smallpox because of vaccines. We've gotten rid of diseases like polio because of vaccines. We shouldn't be politicizing non-science that saves lives.
Let's bring Dr. Karago on the same note. You can choose to answer that question as well, but also that question does not necessarily focus on the US. And I know there are a lot of studies being done elsewhere around the world. In fact, there was an interesting study done by the French doctors, and their opinion was, let's go and test this in the African market. And I think most people didn't like the fact that they want to try African market first. That was really very bad. And I think there's also opinion coming from Madagascar, that Madagascans had also discovered a vaccine, but that was very quickly disputed. What do you say on the same note?
So, man, these are such difficult issues. First, I want to agree with, I want to really reiterate the point that Dr. Bagonko made. There are a lot of illnesses that without vaccines would devastate the population of this planet that we live in. There are many diseases now that their colleagues in training who they have never seen and will never see, or started seeing again when people were not being vaccinated. There are a lot of vaccine projects at different levels. Some exploratory, some in just the preclinical phases, and then a number that are in what they call the phase 3 trials, where you have vaccines being tested across a large number of people, that in the tens of thousands. And this is to make sure that, one, the vaccine causes the body to have an immune response that will then protect the person, and then that it is safe for people who are receiving the vaccine. Now, for you to really have a good trial, you want to have as many people or as many different populations be tested. So that includes black and brown populations, people who are white. So it's not, you want to make sure that a vaccine is not going to have a problem in one part of the population as opposed to the other. The concern, of course, is that word experimentation. As you know, across the world, this country in particular, there is a lot of concerns about experimentation that has been done on people of color. I think many people might have heard of the Tuskegee experiment, where you know, from 1932 till 1972, which is just the other day, black men who had syphilis were allowed to were not treated for that disease, so that you know, physicians could observe the progress of a disease. So you can imagine a disease that, you know, not only will eventually kill some of the people, was allowed to kill folks. So people are very suspicious. And then, of course, when you hear a company saying, oh, we have a vaccine we want to test, but we want to first test it on Africans. People are like, okay, my friend, if we are all part of the trial, it's different. So people are not feeling like they are being used as experimental lab rats or whatever. But for this disease, one of the key components of eventually stopping the spread of COVID is going to be vaccination. Unfortunately, as Dr. Bagonko alluded to, and as you alluded to, this process has become politicized. Again, at the worst time is to politicize a vaccine. If you look at the development of vaccines, vaccine development takes place over years, right? Because you have to first figure out, what part are you going to use to create the immune response? Is it safe? Going through all kinds of little, background, essentially checks and balances, so that the final product is something that is safe and that the public will feel comfortable giving to even their own children. Unfortunately, now we have a situation where the science has changed. I mean, vaccine development now, especially some of the vaccines that are called RNA-based vaccines, can be developed in a much faster way to be used in situations of global pandemics as we are in right now. So the science is there. People are working hard, but of course, when there's politicization of this process, it makes people's trust level in what the final product is going to be less. And so politics for sure has to be removed out from this whole process, so that when the scientists finally come out and say, okay, we have a product, and we think this product is useful and it will help protect people, then folks will trust. But already, because of the politicization of the process, there are so many people who are scared of receiving a vaccine that they are not 100% sure that it is safe.
Good response there. So I just got a text message, somebody reminding me, did you say Madagascar discovered the vaccine? No, I didn't say that. There was a suggestion, but it's not been proven. Somebody's telling me, hey, tell the viewers it's a concoction, it's not a vaccine. Okay, but again, like I said, there are so many schools of thought that are coming up with this. Again, we'll have to give room for research and the medical staff to come up with the vaccine. But again, I think with that, this probably might coming close to the end. And I think what this really means, Dr. Bogongo, Dr. Kiragu, is information is key. And I want to thank you very kindly for agreeing to come on the show to share your perspectives and insights about what this is. But on a larger scale, it also means that for our population, particularly the immigrants, those ones who are placed somewhere, whether in medicine, whether in law, whether in schools or academia, I think it's an opportunity for us also to give back to our communities. It's okay to sit in our offices and in our comfortable homes, but I think if we don't share these perspectives, I think we also as guilty as so may be judged. So I think we also encourage our brothers and sisters, whether you're from Kenya, Nigeria, whatever country from Africa, if you want to come on the show to share your perspectives, I think that'd be good so that our people at least are placed in a better position. And I think I like the fact that you alluded to the Tuskegee experience. Actually, my students are using that as a case study right now. And I think that's why the question is coming out, who is supposed to be tested? I think those of you can check on the Tuskegee experience and see how that can affect millions of people. So before we finish up, I'm going to let you make your closing statement. Go ahead, Dr. Kiragu.
I wanted to mention something just about that. The sad thing is that it is so important, given that Black and brown populations and immigrants are at much higher risk, that they are part of the testing of vaccines. But unfortunately, because of all these politics and this history, it makes it even more difficult to get people to volunteer to be part of the vaccine trials. So, I mean, it's almost a catch-22 situation. So I'm hoping your students, as they do their research, will be able to come up with some good ideas of how we can overcome this problem. And I do see there is a question there, by the way, about proven medicines to treat coronavirus. And this is a situation where there is no one medicine that can treat this virus. There are some medications that are helpful for patients who are critically ill, remdesivir. There's some work being done to study convalescent serum, which is this plasma from patients who've recovered from COVID. If you remember, there was some crazy lady that came and said hydroxychloroquine and all this other stuff works. But no, that there is no study that has shown definitively that that medication works. So the best thing to do is to do your best not to get coronavirus. That's what you can do.
In our communities, actually, some now say, if you get it, don't even go to hospitals. Yes, before that point, take care of yourself, stay home, follow the guidelines before you even think of going to a hospital bed. So, gentlemen, it's an absolute pleasure having you on the show. But obviously, I want to have you make your closing statement. There are people watching across the country. There are people watching from Africa, and there are those ones who will be watching this show even days and months to come. So, let's begin with you, Dr. Bogongo.
So just a quick, so we know what COVID-19 does to your body. We know that if it gets to your lungs, you form significant mucus plugs in your airway, which make it impossible for you to breathe because of too much inflammation. So we know that we need to mitigate that. We give you steroids. I think it's been accepted that that's a reasonable thing to do. We know that it's important to slow down the progression of the virus and so on. So the only experimental drug that has been passed for us to do that is remdesivir. So we're using that. We've also realized that you tend to form clots very easily when you have COVID-19. And so we have extensively studied patients who have COVID with preventive medicine so they don't get blood clots. That has really improved the outcome in terms of how many people end up getting sicker than they should, people that are getting blood clots in their lungs, strokes, and heart attacks. I think that has gone down because of that. And as Dr. Kiragu said, we've also seen that for a certain subset of patients, if you give them plasma from those who have antibodies to COVID, there's some anecdotal evidence that suggests that it works. As far as today's subject is concerned, I just want to say that COVID-19 is real. It could affect you or somebody you know. Let's not play politics about it. We have very rapidly available new science about how best to take care of the disease. Let us trust our caregivers and our scientists and our doctors, and don't stay at home thinking that if I take a concoction, whether it's from Madagascar or whatever, or hydroxychloroquine, that I'm somehow going to miraculously get better. Take advantage of the science that is evolving. That's just, this is a new disease, and I think you need to get the benefit of what the current science is. As far as our communities are concerned, if you have a loved one in the village, create a bubble around them. Let them not just go anywhere they want without masks. If you have a very elderly parent or a parent who has diabetes, hypertension, please create a bubble around them. And by a bubble, I mean they should not be interacting with people that they don't know, people who are just coming by. You don't know whether they've traveled from how far, because it's extremely easy to prevent COVID. It's a lot more complex and devastating to try and treat it, especially if you're in an area that has very limited resources. So, and for that, thanks for having us on the show.
Thank you, Dr. Bogongo. And there's an additional question there for you as you make your closing statement, Dr. Kiragu. I know there are so many questions that will come, but I'm happy that both of you have agreed to come back to the show again to share your experiences with the community. So on the same note, Dr. Kiragu, and a response to that question as well.
It does bring, thanks for the question about experience with children. I think there has been in many ways talk that COVID doesn't affect children, but it does. There are in our own state, of the 96,000 positive tests, about 15,000 are in children less than 19. For many of those children, the disease is mild, but there are some who have gotten critically ill from the illness, or have later then developed this multi-system inflammatory syndrome, which puts them and their lives at additional risk, because it affects different systems in the body, and including the heart. So I agree with the sentiments expressed by my colleague, Dr. Bawonko. This illness is real. This is an illness that to this point has affected about 32 million people around the world, and killed almost 1 million. And this is just since we started hearing about it earlier this year in January or February. So this is a disease that in many ways is easy to prevent. Masking, washing your hands, social distance, being thoughtful about protecting those around you, those who you love, but also the hope that as a society we can protect each other. Because if we protect each other and deny the disease a place to take hold, then instead of prolonging the period of time where we can have this negative economic impact, the negative impact of schools being closed, that reduces that time. And so it's so important for us to take this illness seriously. But also to remember that yes, it does affect and impact our children. And even though many of them are asymptomatic, especially the older children, can spread the disease to those in the household who might be at significant risk, or may spread the illness to healthcare workers or others in the society. So it's so important for us to listen to the science, to follow the science, so that we can eventually defeat this virus and this illness. And of course, it is so important to remove politics from the equation. And my hope is that in the coming year, we will be in a situation where it will be less politics and more science, and so that we really, as a society across the world, we can protect those that are most vulnerable, and which this disease has essentially shown bear the brunt of the illness. So thank you again for having us here and for this conversation. There are so many different aspects of COVID-19 that this is a disease that really has shown the world in so many ways our vulnerabilities, but yet potentially could show how, if we all come together, we can actually solve a problem such as this. Thank you.
Even go, I just received a text message that I did miss a major part of our discussion. This discussion is not all about COVID, it's also the big picture. Somebody's asking me, these are two very high-profile medical doctors, and there are many young boys and girls in our community who want to be where you are in the next 5, 10, 20 years. So in 1 minute, Dr. Kirago, what do you say to those young ones?
So I would say it is important to follow that dream, to work hard in school so that you put yourself in a situation where acceptance into medical school is not problematic. There is a need for young men and women of color to join the medical community because our patients who are black and brown, our patients who are immigrants, really do better when the person taking care of them looks like them, understands where they might be coming from. And we at the University of Minnesota Medical School have really made a concerted effort and really made a decision to be really thoughtful about including and making the net wider to draw in students from different backgrounds who add to the richness of the class, who are just as smart as any of the other students that we have there, but who will have such a big impact on the communities in which then they end up going to serve. I think it is so important. So I'd encourage you, work hard in school. Please don't let anyone say that, oh, it's too hard or you shouldn't do that. No, you should do it. There's no reason why you can't be a doctor. There's no reason why you can't be a neurosurgeon or a pediatric intensivist. Up until just a few years ago, you'd be surprised to know that I was the only Black pediatric ICU doctor in the whole state of Minnesota. And I would so much love to say, see, I have my young brother and sister from Kenya or Liberia or other parts of their diaspora who are here, who have dedicated their efforts into joining the medical community and becoming, again, part of the solution of the medical of the illnesses that impact our society and especially our own people.
Thank you, Dr. Kiragu. Dr. Bogongo, same question.
Yeah, so last month I was fortunate to be elected as to lead the Minnesota Medical Association. I think there are three pieces to this. One is the House of Medicine, which I'm a part of, in terms of, do we really believe that our citizens will get the right care when the demographics are so skewed? The research already shows that you're likely to get better healthcare, especially if you don't speak English or English is not your first language, at least from somebody who looks and speaks like you. So there's an urgency for us to look at how do we encourage people of color to get into medical school. Just yesterday, we finished our annual conference and we talked about inequality that is racial in the healthcare space. And it's very apparent to me that we have to do something specific about encouraging kids of color to go into medical school. I'm hoping that spans a platform during my tenure, at least, to promote the idea that we should try and graduate 100 kids in the next 10 years, at least 100 kids a year, kids of color going into medicine. Having said that, the medical school, as Professor has just said, already knows that they have to do something. They are making efforts to do that. What remains is for our community to encourage our kids that healthcare as a career, going to medical school, is viable. I think it's a very long journey. It requires a partnership between the community and parents. And so the missing link is really a mentorship program. How do we link people like Professor Kiragu and myself to kids who aspire to become physicians so that they know what they're getting into? It's not one of those spur of the moment things you say, hey, I think I like Professor Kiragu's deal. I want to be like him. It's a commitment that I think needs to start a lot earlier. It needs to start in elementary school, maybe in early high school. There are habits you have to develop around diligence, around focus on basic science, and having a sense that once you get in, it's a really long journey. It's arduous, it's rewarding, but our kids can do it. They just need a little bit of encouragement. So I'm hoping that during my time, at least from the House of Medicine standpoint, that I've already approached the Minnesota Association of Black Physicians, and they are excited about a partnership to see how can we create a framework, a mentorship of opportunities, to whether we have to go to every single high school, every single church, whether we have to have community forums with parents. We need to do something to spur this interest in healthcare. And I think we are the ones who can do it. I don't see, an old white-haired man from Wayzata who was born there and grew up there, and all of a sudden it matters to him that a Black kid needs to become a physician. I think it's going to take people like Professor Kiragu, myself, and other well-meaning physicians of color to say, you know what, we think we can help. And I think the part we help is to provide direction and mentorship.
One point that both of you didn't mention, and I want to mention here while the viewers are watching, is that there is a commitment between KDRTV and both of you that thanks for your great work, of course, in your field, that in part of giving back to society, you will at the very least once in a month be coming on the show, at least to share your perspective about matters of health and medicine, again, depending on the state of the health of the nation and the world. So again, on behalf of our team here at KDRTV, we want to thank you for making that commitment. But also, further than that, to remind you that we are so proud of you. You're very high-profile doctors. Remember, whatever you do, yes, God has given you the talent, but you should know that we are very proud of you. Whatever you do, just know that behind you is a community of diasporians who are so proud of you and ready to support you in whichever way we can. And by extension, that also means that to our communities, people who are in whatever position that you are, yes, it's okay, you can have your private life, that's fine, but it really doesn't cost much coming on the here to share your experience and perspective so that we can motivate the next generation. I don't think we're here to stay forever, but I think if we continue these conversations, the next generation, I think, will be much prouder than what we have at the moment. So again, gentlemen, it's been an absolute pleasure talking to you, and I'm hoping that we'll continue this partnership. Again, Dr. Kiragu, thank you. Dr. Bogongo, thank you. And by the way, both of you look great. I like the gray hair.
Asante daktari. Hata
wewe uko nayo, naona umejibamba.
Now I'm liking it even more. No, thank you for making me that comfortable. Okay, guys, thank you. It's been good having you again. For our viewers, thank you so much for being with us today. We started that conversation earlier on, talking to Elias Okari, a good friend to Dr. Bogongo, by the way, who worked at the Nation House many years ago. Thank you for doing that, and a good conversation as well with Mayor John Letno of County. Anoka, I think you want to be commissioner there. I think you sent me a text message, so I appreciate you for that. So happy to have you. But before you go, please go to Facebook. We need subscription. Go to Facebook, like us, and make a comment. Especially, we're interested in getting your feedback. Positive or negative, at least we need to grow. So really, your feedback is very important for us. At the same time, also go to Twitter, follow us there. We're streaming live. And on YouTube, again, you don't have to pay when you subscribe. Just click subscribe, and that's pretty much what we need so that we can move further into regular programming. Sooner than later, our intent here is to go regular programming so that we have people who come on and talk about medical, different topics. For example, we might have Dr. Bogongo Kiragu moderate matters of medicine. We can have professors, business world, and something like that. So the goal here on KDRTV is to go to regular programming as soon as possible. Again, thank you so much for being with us. Next week on Sunday, we're moving into the business world. Of course, we've seen medical doctors here. We've seen people in different departments who making good cases for the diasporans. But next week, we're going to go into the business world. And Nasibu Sarafa, Tanzania's own, who also is the executive director of the African Development Center, in Minneapolis, has made a commitment to come here on the show to talk about businesses, really. And we'll be talking about the power of numbers. There are thousands and thousands of immigrants here in the United States, and more especially here in the Twin Cities. What does it really mean by being here? And what does it mean if we can use the power of numbers? So our brother Nasibu Sarafa from African Business Center, or African Development Center in Minneapolis, will be here to share his experiences and why we need to work together. So if you're in business or you're interested in starting a business, I think that would be a good time for you to come on and tune and post your questions as need be. So again, thank you so much for being with us here this Sunday. Have a very wonderful Sunday and enjoy your week. We'll see you again here next week at 10 Central Time. Thank you.